Okay, so welcome everybody to this month's Dinner with a Doc. I'm so excited about this month. My name is Dawn Hutchins, and I'm the owner of a company called Veggie Cooking. So I'm a plant-based chef, and I help busy moms and their kids eating and cooking for vitality. And I'm so excited that you guys are all here. And Heather is here as well. She is my co-host.
Hello guys, I'm Heather Borders. I'm the owner of Kylo Nutrition. I am a local dietitian in Jacksonville, Florida. Dawn and I have been doing this all year. We've had a clinician every month, and it's been just such a really fun experience. And every single month, we just love asking the doctors so many questions, and every month we're learning something new. And I am very excited about today's guest, Dr. Will Nields, and the topic that he is going to speak about is brain health and Alzheimer's. So just a short little introduction. Dr. Nields graduated from the College of Medicine of USF, University of South Florida, completed his residency at Mayo in Jacksonville, and he has an established Headwaters Health here in town, a practice to carry out a mission of bringing healing and optimal health to all people. It's a nice mixture of traditional Western medicine training and holistic naturopath and functional medicine. And so it's just amazing. And I see Susan Spell on here as well, and I'm super glad to see her. Who also works at Headwaters Health. So thank you, Dr. Nields, for taking some time this evening to speak to us. We're very excited.
Well, I'm super excited to be here. So thanks for having me.
Absolutely. All right. So what I'd like to do is just allow you to kind of give a little intro to your current role and just give a little bit of more of a background of what you do and what, just tell us a little bit about Headwaters and anything else that you're involved with.
So at Headwaters Health, I started about 3 years ago because working in primary care in a traditional kind of fee-for-service model, the powers that were running that business were not helpful or receptive, or actually became quite obstructive to teaching people how to be healthy. The business model of medicine is to do as much volume as you can and see as many people as you can, and outcomes are not really that important. And that was not a way I could practice. So as they continued to wean back or sort of trim back my programs that we were teaching to teach people how to become healthy and not need a doctor, they just continually were sort of painting me in a corner to the point where obviously it wasn't going to work for me anymore. And I left. I took some time to save up some money. I was working in the nursing home for a time, which was kind of heartbreaking, but it was a means to an end, and then eventually was able to open Headwaters to have a different goal. Rather than being solely focused on the business side, we wanted to build a place where people could learn how to become healthy and not need a doctor as much, right? And then also make a living, right? So to find ways to do that. So that was sort of the impetus. I guess one of the key phrases, or one way to sum this up, is that our philosophy is that healthcare really should be free, because healthcare is what you do at home, and medical care is what we do as physicians, and that should be kind of rare and therefore hopefully affordable. But the system is so skewed that medical care has become extremely expensive, because so many people are utilizing all of these treatments that don't ever get to the root of the problem. So we focus on treating the root cause of illness, and most of the time that's lifestyle issues. And so that's largely how we approach problems. And we're a full service primary care office, so general primary care issues. And through my career working in that, I've developed sort of an interest in brain health, which took a little bit of a turn. And so now I'm focusing a lot more on cognitive health and partnering with a company called Gray Matters, which is a medical clinic system that is focusing on optimizing brain health in the setting of primary care. So it's overall health, but specifically there are some nuances that are very important for brain health, cognitive function. And so that's kind of where I am.
Nice. That's amazing.
That's really exciting.
Yeah.
Well, so tell us about this recipe that you chose. I made it and it was delicious. I actually had some a little earlier for dinner. And I personally love curry, so I was really excited about this. And I also had some chickpeas that I had made earlier, and I think a day or two ago. So I added chickpeas and I added some rice that my daughter had cooked, and it is absolutely delicious. So this will last us at least a couple meals.
Yes, and I added coconut milk just a little bit, and I just wanted to point out garam masala. It's I would say garam masala is just not very known, but I think it is one of the most just delicious spices and seasonings ever, and I think it's just so fragrant. And I'm a big fan of anything curried and anything garam masala is. I'm a fan. So. And this was very easy, by the way. So yeah, go ahead.
Well, so you asked me for a recipe and a couple things. I love Indian food, Asian food, Mexican food, but I chose Indian food, and specifically this one just to highlight a couple of things. The curry is really beneficial for the brain. People that eat a lot of curry have lower rates of Alzheimer's disease, and actually high doses of turmeric in the curry has been shown to dismantle and reverse amyloid beta plaques, which are the plaques that form in Alzheimer's brains. So while about a gram a day of curcumin or turmeric will help for arthritis and inflammatory conditions, when you go to higher doses above a gram, even up to 10 grams, it will remove the amyloid plaque in the brain. So I had to have something with curry. And then I wanted something with crucifers, because a lot of the work that we do, it involves detoxification, and cruciferous vegetables like cauliflower are very important for detoxification.
Well, bonus. I think it's delicious, and it's so nice to know that it is so healthy, and kind of wild that it can actually reverse the amyloid plaques in the brain. So that's fantastic. So Dr. Nields, I know you're going to get into dementia and Alzheimer's. You're going to have a good 15-20 minutes to talk about that. But especially after you mentioned your practice and how, looking at root causes, that's not, like you said, it's not really how the system is designed. And so we're really curious about your journey and how you arrived at to where you are, and to the philosophies that you practice within your practice as well as personally. So can you kind of talk about your plant-centered lifestyle, how you got there, and how it's helped you personally and or professionally, and how it makes a difference for you?
Well, I have to kind of go way back to tell the story. So, I grew up in kind of like a typical American home, Midwest. And, like my dad had a huge garden, and I used to love to eat out of the garden, loved fresh vegetables, hated canned and cooked vegetables. But some of my fondest memories were actually, he had this old red tractor and dug up about a half an acre. And so we had corn and watermelon and strawberries and peas, and it was one of my favorite things. And we had so much fruit, vegetables, that we would go down and sell it on the roadside. And so as a kid, I would take all that money and go and buy baseball cards and stuff. But it was a lot of fun. And so it started there. I always knew intuitively that fruits and vegetables are critical for good health. I spent a little bit of time in college and post-college as a competitive bike racer. And so I was very important to me to eat a lot of antioxidant rich nutrients. And I just knew fruits and vegetables as much as I could get was very important. And then sort of my life took a turn and I went to medical school and felt really a little bit out of place in a lot of ways when I got there. Just people seem to have a different mentality and a different understanding of things. So that's a little foreshadowing. But, I went through medical school as my own person and really always looking for more natural ways to do things and understanding things at the root cause, whether that be from mental health issues to medical health issues, but across the board. But I was always looking for, I wanted to practice medicine in a way that you could intervene in something, see a problem fixed. I like that solution, that end solution. So I was drawn to surgery. I did 4 years of general surgery residency. And the more that I saw the inside of that industry and the lifestyle that it led, which was very unhealthy, I realized I cannot do this for the rest of my life. So for many reasons, I left that, was working in emergency medicine, which is also conducive to you see a problem, you fix a problem, and then you move on. But it becomes pretty clear that most of these problems that you're fixing are really just Band-Aids on bigger problems that started years before the person ever got to your care. So after 8 years in emergency medicine and really feeling that the thrill was gone, so, it's hard work. And I wanted to another change of pace, which maybe that's my personality. I have to keep changing things up to keep my interest level. I moved into primary care, and that's really where I first saw things differently in medicine as now, whereas in the emergency room and in surgery, you're kind of at the bottom of that waterfall, trying to patch people up after they fell over the falls, right? And then primary care, you're upstream in the river and you're trying to pull people out of the river before they go over the falls. So really seeing from a preventative perspective, and that's where I really kind of found my niche. And I will be practicing this way for the rest of my life because that's the part that I really love. So how I got plant-centric, as I said, I was always interested in fruits and vegetables. I just intuitively knew that. I had a epiphany when I was in residency, not sleeping, I'm eating on the run. And one night, and I don't know where I was in the call situation, but hadn't slept in. I know I'm in bad health. My gums were bleeding, and I didn't feel well. And I'm sitting at like 3:00 in the morning looking for some food in the hospital. And I'm at this vending machine and there's this frozen burger. And I'm like, oh, that looks good. I'm going to get that. And as it kind of clunked to the bottom of the machine, I was like, how far you have fallen. Like, if you think eating this is a good idea, like, this is just so wrong. And so it just occurred to me, like, at that point, I need to make some changes. And so I started changing my diet and being much more intentional, even during the stress of residency and so forth, and started learning more. So in truth, what happened was a friend of mine was selling Juice Plus, and he was just getting into it. And he said, you got to try this stuff. It's fruits and vegetables in a capsule. And I was like, give me some of that. I need that because I'm not eating it. And he continued to try to sell me. I'm like, Brian, just give me this stuff. I'm already bought it, And anyways, it's kind of funny, but so I started taking that and I immediately noticed my gums stopped bleeding. And then I started to get involved in some of the things that they were teaching as far as the power of fruits and vegetables. And what I always knew then sort of took on a more of a scientific light. And I understood now some of the biochemistry of these things. And I became very interested in that and continued to study that. Eventually, I started going out and doing lectures for them and about health and nutrition. And through that journey, met Pam Popper and took her class. I don't know if you're familiar with Pam Popper, the Wellness Forum.
Yep.
And so she had a plant-based practitioner class, and it was great. I mean, T. Colin Campbell and Goldhammer and all of these luminaries in the field were our lecturers, and Pavlevsky so all these great lectures, and was reading. I think the China study was a big turning point for me. And so through all of those things, realizing that there's such strong medicine in this plant-based lifestyle, and then I began to incorporate that in the clinic. And to do that, I realized that people needed help making changes. They didn't need just being told what to do, but they needed the support. And then quickly began to realize through doing group sessions, which gave me the time, or eventually we hired, dietitian, and my wife taught classes quite a bit. And she was a kindergarten teacher, which taught me that that's the biggest, most important skill set to this, more so than a medical doctor or a dietitian. I mean, she had the more success than anybody in those classes. But it totally changed the way I looked at medicine. It became much more of community involvement, and then realizing that some of these people are coming just because they're lonely, so there's the whole aspect of the community that you're developing. And so that all is sort of how we morphed into where I am now, which was the need to found a clinic where we could do things differently.
Well, so do you do regular meetings at your clinic, group meetings, where I remember way back before I read the China study, going to Weight Watchers meetings, just trying to lose weight. And I think I went crazy counting points, but is it that kind of a group support? Because that is what I found to be the difference, like you said, is the group meetings and having support.
Yeah, so and Susan, who's on the call tonight, is largely teaching this along with David Bryant, but they are teaching a plant-based curriculum, and there's also some stress relief and things like that in there as well, that focuses on education. So there's an educational component. You have to get the buy-in for people to understand that there's actually science behind what you're telling them. This isn't hocus pocus. And I think there's a certain group of people that really love that education and understanding the intellectual side of it. And then I think for the biggest component is that community support. So so I first started teaching the CHIP class, if you're familiar with that, with my wife many years ago. And one of the common complaints in the class was like, we just can't get this food around Jacksonville. There's no place to go to get this. And what we always would tell people is, yes, it's true. We're teaching you to swim upstream, and you're going to have to work at this because it's not here in this town. But eventually, if enough of us start swimming this way, we're going to create our own current. And so that actually on the door of my office, it says that, creating a new current. And now fast forward 15 years, here we are, the current has been created, and there's a lot of options for people out there. So, so that's been wonderful, but all that to say that it's developing the community to support people, that, if the rest of the family is trying to pull them back into old habits, it's that old crabs in a bucket thing. They have a group of people that are supporting them. If everybody else is going to go to happy hour, they need somebody to go exercise with. They can meet those people in the group. So the idea is to create the type of community for people to connect to that will support their healthy habits, because that's going to be key to maintaining this sustainability.
And do you do that in person or remote?
Right now it's remote. I mean, we started out in person, and COVID changed that. So we've been online. I think the convenience of the online platform, it's going to be the majority of people are going to go to that, because it is a commitment, to spend an hour or two every week in a busy life. I mean, that's a lot that people have to do. So we do have a group of people. They tend to be, the demographic is 70-year-old males who generally are more interested in fellowship than truly, and they like the free food or the samples. So they tend to show up in the office. Since I'm, since things have changed and we're not having too many people, I need to talk to Susan about it, because I have interest. There's people that are saying, I want to come and be in person. Susan and Stephanie Crozier did a cooking demonstration in person, and I think quite a few people showed up for that. I prefer that, but it's just going to be a matter of what people want to do.
That's great. No, this is fantastic. And I love hearing about your story. And, I think it's also a testimony to just even when our instincts, you knew to eat fruits and vegetables from the very beginning, but, life happens and it's a lot of ebbs and flows and we kind of get distracted and then get pulled back. So it's a good story. So today you chose to talk about dementia and Alzheimer's. So I know that I've heard of this as kind of type 3 diabetes. I know this is something that affects so many millions of people. And so I'm very interested to learn more about it. What causes it? Are there things that we can actually do to prevent it? And if it begins, is there anything we can do to kind of slow it down? So really the floor is yours for at least 15-20 minutes to talk about it in any way that you would like. So.
Okay, well, so first, absolutely, we believe that dementia is preventable. There's a lot of different reasons why people can develop dementia, and probably going to learn many more, but most of the things that we know about now, those things can be addressed. We even see people with cognitive decline, which maybe doesn't reach the level of dementia, reversing that and improving cognition and objective measures with testing and things. And then there are multiple cases of people who have full-blown dementia that have come back and regained independence and the ability to care for themselves. So from a layman's or a primary care perspective, non-neurologist, you can simply define dementia as the loss of ability to care for oneself. If I can't cook or clean or even brush my teeth or get to the bathroom, these are signs or symptoms of dementia, right? So my basic understanding and the way I try to talk with people in the real world is that when you lose the independence, the ability to do for yourself, and it starts with independent activities of daily living, things like balancing a checkbook, these things that require executive function, reasoning, higher orders of thinking, complex problem solving, and so forth. Those tend to be the first to go, and people need more help with that. And it can continue to deteriorate if the driving cause isn't addressed, and that leads to the full-blown dementia. Once people are in dementia, it's have crossed that point, it's really hard to show significant clinical improvement. When we work with a lot of people in that, because just like in heart disease and everything else, people often aren't really interested until the problem is really big. So we have experience with that. And what I can say is that pretty much everybody, we slow the decline. Oftentimes we can improve quality of life. And when it's advanced, the biggest problem we have with dementia is that the treatment protocols that we're using are very time, labor intensive, and there's cost that's associated with it. So when somebody's become demented, it's hard to keep them going with all the exercise and the brain challenging activities and this, regimens that you have to do. So we really want to try to catch this upstream, and the sooner we can do it, the earlier we can intervene, the better. So there is a sort of general rule that our brains kind of peak out at about 45 years old. Okay, so at 45, your brain function is functioning about as best it can. You have the experience to draw from. Your processing speed is still pretty fast, and in general, we're speaking. And so at that point, you could say that from here, it's all downhill, right? You're going to likely see a slow cognitive decline. Just like our kidney function loses a couple, our EGFR drops a couple points every year, your cognitive function slowly drops over the years. And there are things that can speed that up and cause people to have faster cognitive decline. And there are things that you can do to slow that down or possibly even optimize brain health and bump up the cognitive function. And so with everything, when you take a comprehensive view at literature and look at everything that's been shown to impact brain health, and you say, what if we do everything? And you start an investigation. So you look under every stone and do a big investigation. You can find a lot of things that are going to predispose people to cognitive decline, and then you address them. And the earlier that you address them, the more wiggle room you have. So you mentioned blood sugar. That's a big one. Now, if you look at traditional medical treatment for diabetes, it's based on large volumes of data that show that if we can get your hemoglobin A1C, which is a measure of how high your sugar is, down to about 7, which is really pretty high, we can prevent amputations and blindness and dialysis. And if we also get your cholesterol down and get your blood pressure down, we can impact heart attacks and reduce the number of heart attacks that happen. But the brain is much more sensitive, and the brain needs those glucose levels much lower. So we're shooting for A1C levels down around 5.2, which most primary care doctors will say, well, that's just crazy. That's just too much work. You know, you're fine at 5.6, 5.7, 5.8. It's just a little pre-diabetes. It's nothing to worry about. But the truth is that when your blood sugars are running that high, it's often a sign of insulin resistance. And the brain does not tolerate insulin resistance well at all. Your brain burns about a third of the glucose in the body. It's only about 5% of the weight. It is a highly metabolically active organ. So it burns a lot of energy. It requires a lot of glucose. And when you're not getting glucose into the brain cells because of insulin resistance, the brain, it's like a car running out of gas. It kind of chugs a little bit and it doesn't function as well. And then it further creates some inflammatory processes. So inflammation is another big driver of cognitive decline. So that's another thing that we look for, and it can often be hand in hand with high glucose. So when we look at all of these different parameters, you know, it's a bunch of labs and a really thorough medical history. It gives you a picture of an individual's risk factors, and each individual is going to have a different situation. So it's very individualized and personalized, and it can be impacted by genetics and environment and so many different things. So what all of that is at 45 years old, we say, you know, people should take a deep dive into their cognitive risk. Okay. We get a lot of people with family history, so they're very interested in doing preventative work. And so we call that a cognoscopy, right? Just like you would get a colonoscopy to look for early signs of colon cancer. A cognoscopy is looking at all these different factors, a lot of blood work and questionnaires. So it's not as invasive as a colonoscopy, but probably equally as important. And this is kind of funny, and this is where Gray Matters really asks the question to people is, you know, you do preventative cardiac screening, you do preventative cancer screening. What do you do for preventive screening for your brain in the medical system? And the answer is, you know, really nothing. We do these little screens to detect it early. And then as a primary care physician, that's always been prior to learning about these protocols was I didn't like doing that because I would diagnose cognitive decline. I had nothing to offer people. And it would just be really a matter of like, should I take this person's keys away? You know, am I going to put something in the chart that's going to prevent them from getting long-term care insurance and so forth? Not that I can take keys away. I mean, we're supposed to alert the DMV that this person might be trouble, but you get my point. Like there's no benefit. And because of that, I think doctors avoid it sometimes. And the patients hide it. They want to try to hide it because the only outcome is going to be that you're going to lose privileges and independence. So we're trying to reverse that understanding to get people to get checked early. You can do it discreetly. You can do a lot of things to impact your cognitive trajectory over time. Okay. So we talked about glycotoxicity. I talked a little bit about inflammation, but that's very important. If you have a lot of inflammation in the body and especially in the brain, that's going to cause aging in the brain and dysfunction in the brain tissues and the cells. So that's important. We also look at things like hormones and things like vitamin D. we lump these in together as sort of what we call trophic support, but these are, you could make the analogy of a soil for your garden, right? If you don't have the nutrients in the soil, you don't have enough of these hormones, if your vitamin D level's low, the brain gets this signal that it's not good, conditions aren't good, and we should start retracting, and it will shrink. And so this is why women who have a surgical oophorectomy, in other words, a hysterectomy, and their ovaries removed, if they do that before menopause, they have a double the risk of Alzheimer's disease if they don't take hormone replacement, because estrogen is very strong signal to the brain that conditions are good, keep your connections strong, those synapses strong, keep the nerve cells strong. If you suddenly remove estrogen, the brain flips into this default mechanism and goes into the shrinking pattern, and has to do with these feedback loops. So estrogen and testosterone and progesterone and these things are important, as well as vitamin D. And so we call that trophic support. So that's part of the cognoscopy. Then we look at toxins, okay? Toxins is an extremely big area, and it's far underappreciated. And especially in sort of the medical school, you learn about it in basic science, but when you go to the wards and learn how do you really practice medicine, you never really deal with it, other than really obvious rare cases of just huge poisonings and things like that. But we are living in a toxic stew these days. There are so many chemicals that are toxic to the brain. We have mercury in our dental fillings. We have mercury in the food supply and the water supply. We have all kinds of organic organophosphate pesticides, which are neurotoxins. We have environmental toxins, which could be like mold growing in the AC unit or in the wall behind the shower, which secrete toxins that are neurotoxins. And so we find that a lot. So you have to identify toxins, and that's one of the harder areas to treat. But there are things that you can do to help your body's natural detoxification methods. And so that's a big part of the protocols. And then we have chronic infections. So the idea that Alzheimer's disease is a function of these plaques is something that was promoted long ago, and has been proven not to be true, but really hard to die. So in other words, Alois Alzheimer's, I think in 1910, he was a physician in Austria. He found a patient that had dementia early and did autopsy, and he found these plaques in her brain. And those plaques are made up of amyloid beta. And to this day, that's how we diagnose Alzheimer's disease. If you have amyloid beta plaques in a certain pattern, that causes those nerve cells to die. And that's Alzheimer's disease. Well,
really quick, Dr. Nields, what is that test? Is there a blood test or is there a brain scan? How do you know the amyloid? How do you know that's there?
So that's a great question. The truth is that in most of studies, it's done at autopsy. Okay.
Oh.
However, you can
That's not
get
good.
That doesn't help.
Yeah. But you can get an FDG PET scan. Sorry, not an FDG PET. You can get an amyloid PET. Okay, so this is a PET scan, and unfortunately, they're not covered. Typically, they cost about somewhere $1,500 to $2,000 to scan your brain. There are ways that, like the hospitalists and people who are working in the hospitals know that you can do a lumbar puncture and take some CSF, and you measure the ratio of proteins in the cerebral spinal fluid. That's invasive, and people don't like to do that. I will say that there are people working on blood markers, and they're becoming pretty close to being commercially available. So I was told that in about a year or two, we should have a blood marker that can detect tau tangles and by proxy amyloid plaque burden. So that's coming soon.
That's huge. That's going to be huge.
Yep, that'll revolutionize things, because I think it'll help people get an earlier start on prevention and treatment.
Wow. Okay. Thank you.
So what we rely on, honestly, Heather, is, okay, people coming in, we want people to do things preventatively and proactively. So 45 years old, if you're interested, we recommend getting tested to some degree or another. if people that are having symptoms for sure should, and these would be symptoms. So a lot of this is just good clinical history. Like, I'm not finding words as well, or I can't remember sometimes where I parked my car, or I, have a hard time remembering names, or etc. Right. So my my processing speed might be a little slower. It just takes me a little longer to do tasks. These are what we call subjective complaints. Nobody else really notices it. You might just say, oh, this is just normal, like it's a brain fart, right? Is what people say. But there are signs that the brain is not functioning optimally. And so you want to look, if you're seeing signs like that, and see if there's anything that could be causing that, or is it just something like, well, I was really stressed out because I was running late. And when my cortisol levels are high, my brain doesn't function as well, right? We don't need to solve a calculus problem when we're being stressed by a bear, right? Or an attack. We need to run or fight. It's not a cognitive process. So cortisol is really toxic to the brain. That's also part of the cognoscopy, but it's a temporary thing, right? So we all are probably familiar with that. We get stressed out and we have a little bit of trouble thinking, freeze or whatever. Stress goes away and the brain comes back. So we look at clinical symptoms largely, and family history is important, says that alerts a lot of people. We got a lot of people that have done some type of genetic testing and they're found to have certain genes, like an ApoE4 gene, which is a very common gene. Millions and millions of Americans have this gene, and it's not the most powerful gene that impacts dementia, but it is the most common one, so probably the most important. So I'll throw out some numbers. If you have no copies of the ApoE4, right, so you're clear in that, you have about an 8 to 10% lifetime risk of developing Alzheimer's disease, maybe 1 in 10. If you have one copy, that jumps to about 1 in 3. And if you have 2 copies, it's about 2 in 3. So 67% of people with 2 copies of ApoE will develop Alzheimer's. That also means 1/3 of people won't. So they've done a lot of study of those people. And so far, the best that they can tell is it has to do with people keeping their brains actively challenged. So people that have very challenging intellectual jobs seem to be the ones that don't develop Alzheimer's disease.
So I'm going to go get a PhD at 65.
There you go. Keeping your brain challenged. And so, this is getting into what can we actually do if our brains are struggling, or how do we keep our brains young? And cognitive challenging things are extremely important. So Heather, I'll give you a guess. With all the activities that if you think about older people and what they do, what is the one activity that prevents cognitive decline more than any others?
I'm going to go with social connectivity, like being around people and being active and having people around you.
That's a great guess, and it's an important thing. And it's a subtype. It's I think a sub-contributor to why ballroom dancing is the one activity that has the best cognitive outcomes.
Oh, me and Don, we're gonna go ballroom dancing. Let's go.
Yep, sign us up.
Yeah, I mean, if you've ever tried to do it, I mean, it takes some cognitive skills. You have to remember the steps, and then you have to activate your feet. And so there's a motor component, and that motor component seems to be very important. So there's the cognitive challenge, there's the social input, there's the motor challenge, and so forth. So ballroom dancing is a great activity for people. Dr. Shirzai, who you may be familiar with, he's written a great book about Alzheimer's disease and how important the plant-based diet is, talks about playing music, right? So if you can read music and play an instrument, you activate every single area of your brain. And so that is important. So you're activating all of those different domains of your brain. So people that like to play instruments, I always encourage that. But you want to do a brain challenging activity for sure. And you want to get that physical movement and physical exercise in. Because when you exercise, you secrete stuff called brain-derived neurotrophic factor. That's nothing more than fertilizer for your brain cells. It causes brain neurites to go out and grow and connect. So that exercise has been shown to increase hippocampal volume, which is the amount of nerve connections you have in the memory part of your brain. Okay, so chronic stress, they've shown, shrinks that hippocampus. It destroys people's brain, that part of the brain that controls memories, forming and recalling memories. However, exercise does the opposite. And guess what? Exercise is a great stress buster. So that works well for a lot of people. So physical activity, breaking a sweat while you exercise is actually a great detoxification process. Your body eliminates toxins through the breath when you're breathing and through the sweat. So you can start to see how a lot of these strategies to prevent cognitive decline tend to be lifestyle strategies. Dr. Shirzai has written a lot about the importance of diet. So fruit and vegetables. If you eat 400 grams of fruit and vegetables a day, you have a much lower risk of cognitive decline and dementia than people that are eating less than 100 grams a day. The Rush study in Chicago showed that nutrient-dense diets are extremely important to prevent Alzheimer's disease. So if you're eating fruits, vegetables, all of that dense nutrition, you're going to be much less prone to Alzheimer's than the standard American diet full of saturated fat and processed sugars. Okay. And those things are going to manifest how inflammation, your CRP is going to be up, your blood sugar is going to be up, and all of those things that we said earlier are injurious to the brain. They're artifacts of our lifestyle. So it gets back to a lot of the same points that you could say are important for diabetes reversal and cardiac disease reversal. But the brain, there's another a few more nuances that make it a little trickier. And one I mentioned was toxins and the hormones and things like that. But the other one, and this gets to be a little bit difficult for to put in the context of the plant-based community, is that you need certain nutrients like fats are very important for the brain. Choline is an important thing for neurotransmitters. And of course, your B vitamins is extremely important. So I think people on a vegan diet, you have to be very intentional to get enough fat in your diet from things like nuts, seeds. You can use olives. I'm becoming more and more convinced that oil, used properly, is not for some people the worst thing, especially when it comes to brain health. If we're trying to give them calories apart from, too many starches and carbs. I've got patients, and I can do genetics on them, and they're set up for diabetes. They don't process carbs well, so they need some type of food calories, and we don't want them eating a bunch of animal products. So plant-based fats are a great fuel source, and it turns out they really help the brain. So we often, especially for people with the ApoE4 gene or with more advanced cognitive decline, we want to get them into ketosis, and we use a plant-based ketotic diet for that. Okay. So it's not bacon butter ketosis, it's a plant-based ketotic diet, but we're using a lot of fats, and usually to get the calories in, we're using some oils. So this is not what I would prescribe for a cardiac patient. So in our classes that we teach, we're not teaching that lifestyle for most people because they're dealing with cardiac disease, diabetes, and those things. But to say that for the brain, sometimes you have to adjust your approach to the patient, right? So that's the one.
If I may interrupt just really quickly, I hear a lot about eating fish or seafood for brain health, and there's so many mixed views on that. What is your take on that as far as brain health specifically, in this case for preventing dementia or Alzheimer's?
So the reason why people are recommending fish for the brain is for omega-3 fatty acids, okay, which are shown over and over to be super important for the brain. And I put almost every brain patient on 3 to 4 grams of DHA EPA a day, so large doses.
Mm-hmm.
If you were to eat enough fish to do that, you would be so toxic from all the pollutants that are harbored in fish, whether it's from mercury or PCBs and other things, that I don't typically recommend, people to eat a lot of fish.
Mm-hmm.
My approach is very much to meet people where they're at, so most of my discussions with, I say there's a big portion, and this is changing, thankfully, over the years. More and more people are becoming open to being plant-based. But I have a lot of people that they're kind of bargaining with me. And so the conversation usually boils down to the question, well, how much can I get away with, right? How much meat can I eat? And, the answer, I think there is some individual variability with that when it comes to heart disease and diabetes and everything. With things like fish, if they want to eat fish and they're going to tell you, like, I'm going to eat that. I'm not going to do what you tell me. We're going to encourage them to eat smaller non-predatory fish, which tend to have less bioaccumulations of the toxins. So that's going to be things like sardines, anchovies, small herring, small mackerel, and salmon. These are smash fish. Again, I don't encourage people to eat fish. It's more of a compromise if we go there. I much prefer to use the supplements because they're not going to have the toxins in it. Nordic
Okay,
Naturals.
that makes sense.
Mhm.
Mm.
Yeah.
Nordic Naturals.
Yeah, it's a good company because they allow a third party to come in and look at what, so I can look up any batch of Nordic Naturals and see how much PCBs are in that. And, the oil is not where the mercury is. The mercury is in the muscle of the animal. So you're not going to get mercury through the oil. You can get exposed to PCBs, but they do a really good job of doing it very cleanly, and their levels of PCBs and these other toxins are well below accepted standards.
So Dr. Nields, it's we've got about 10 minutes until the top of the hour. I know we got started a little late, so we'll go a little bit over, but we do have some questions. I know I have some questions. So I just wanted to give you just a few more minutes to kind of wrap up with what you want to finish with. But I want to make sure we get to people's questions.
Mm-hmm.
So yeah, if you have a few more minutes to talk, that's fine. I just wanted to give you a heads up.
Sure. I'm just sort of rambling. I didn't do a good job of organizing things, but I think that to sum it up, I think there's a lot that can be done for the brain, and we want to educate people to that you want to get checked out by somebody that is interested in this kind of care and knows all about all these different factors to look for. And if you find stuff, you can address it. And there's a lot more wiggle room the earlier you get in that process. It's not a one size fits all program, but there are foundational things that everybody can benefit from, which would be healthy plant-based diet. You have to watch out for certain nutrients like choline, which makes acetylcholine. Your B vitamins, vitamin D is not necessarily a nutrient, but and then the omega-3s, right? Those are important things. You can get those on a plant-based diet, but you have to be intentional about that. And then exercise, hugely important. We sort of, if you follow Goldhammer, I'm a big fan of the pleasure trap, but we sort of not hardwired not to exercise. We're going to conserve energy, but get out there and do it. It's so important for your brain as well as the rest of your body, and you feel better. Managing your stress. We don't get to pick the challenges that happen to us, but we do get to manage how we react to those challenges. So it's crucial to have perspective. I see a lot of patients that, they have meditation and different practices, but they still really struggle. And so I think that extra piece that gets missed a lot is perspective. So taking a step back, realizing we're all floating around on this little speck of dust, and there's a much bigger thing out there, that not to get so focused on what's right in front of us in our life, and have a bigger perspective. That really helps let things go sometimes. The things that we find so important to us at various different aspects of life, as we get older, we realize, really, I shouldn't worry so much about that stuff. So not so much that you're going to avoid stressors, but how you react to them is extremely important. Love Viktor Frankl, great psychiatrist, that said that the small space between a stimulus and our response lies our happiness. And he knew, he learned that when he was in a concentration camp during the Holocaust, right? So there's this things that happen to us, and then there's how we respond. And in that small space between that lies our happiness, is what he said. So that's been really important for me in my life, trying to live that out, right? Diet, exercise, stress management. We talked about diet. That's, super important, maybe one of the biggest factors. And then sleep I didn't mention, but sleep is extremely important for your brain. You have to give the brain time to rest and recuperate and recharge. And that happens during deep sleep. So if you have sleep apnea, that's a great risk for cognitive decline. If you're not oxygenating well at night, cognitive decline. I've seen people, you just put oxygen on them at night and their brain function just turns around. I've seen, and sleep apnea is not always for the kind of metabolic syndrome, thick-necked patient. There are many people that have this upper airway resistance syndrome where they're narrow airways and a narrow, place back here, oropharynx, and they obstruct at night. So you see a lot of skinny people tend to have, it can be associated with anxiety and things. So the dentists are pretty good at diagnosing this. They'll do cone beam CT scans and look at the airway volume. And that we've diagnosed sometimes people you would never guess that have sleep apnea. But if you're tired during the day, you definitely need to think about that. So, and then cognitive activities, social engagement, and making sure you're not loaded down with toxins. If you do all of those things, you're likely going to have a good metabolism. Some people need a little bit more help with that. And then lastly, there are, especially as people get older, there are different botanical supplements or we're using plants and herbs as medicines, right? So these things like turmeric, which we mentioned, removes plaques and causes decreased inflammation. Ashwagandha can be very helpful for modulating stress. NAD can be good for mitochondrial dysfunction. So there's a lot of these supplements that you can use that really make a difference. Lion's mane mushroom, great anti-inflammatory, good for the brain. Mushrooms, great for the brain. So that's sort of the protocol in a nutshell. You have to find out what's driving the individual's problem, and then you address it with things that address that particular issue. There are a lot of tools out there now that you can look for these things. There's some great genetic tools out there that unfortunately are still out of pocket. They can cost, anywhere from $400 to $2,000, but you can get a tremendous amount of very helpful information looking at your genetics. So that's sort of the way, in a nutshell, to sum it up, how we approach all of this.
Wow, that was such a wonderful wealth of information. I have so many questions, but I know there's at least 2 from the audience, so let's get through them, and then maybe we can run through our little rapid fire questions that we ask every guest. So one person asked if several members of your family on your maternal side had dementia/Alzheimer's. All are deceased now. And is there a test to find out if you're heading in the right direction or same direction? And so it sounds like that that cognoscopy might be where to start. So would it be that? Would it be anything else? And then where do we how can we get that done?
Yeah, so absolutely. There's no one single test. I would get a thorough evaluation of all the factors that contribute to brain decline. With a family history, you're definitely going to want to look at your genetics, and that ApoE4 gene could be really important. Some neurologists will say, well, why? There's nothing you can do about it, so why check? We don't recommend it. It's just going to make you worry. I disagree with that 100%, because if you know what ApoE does, which it increases inflammation and it increases glycotoxicity or sugar problems, you can address those issues, okay? You can address the fundamental biological issues that make that gene so bad. So I will just give that caveat, because you may hear difference of opinions from neurologists and experts out there. But looking at what your particular risk factors are, a lot of it depends on your age. If you're noticing some symptoms, we do a MOCA test. It's a pretty easy 20, 30-minute test in the office to check and see. It's like, how's your processing speed? How's your attention and focus? How's your language ability? How's your visuospatial function? If you're having more symptoms or you want more information, you can go and get neuropsychological testing. It's a 4-hour battery of tests, gives a ton of information, and can get really down into some great details. We have some computerized testing that we use online, sort of a mini neuropsych eval. So a lot that you can do. You have to find somebody that knows how to do this. So the protocol that I'm using is developed by a UCLA researcher by the name of Dale Bredesen. He's trained people around the country. So we are the Dale Bredesen Clinic. So I work directly with Dale. So, we can do these evaluations, but there are many people that are trained by him around the country that can do this.
Okay, and then just to circle back around, that cognoscopy, is that something that you can do at your place?
Yes.
Okay, and is this like a 1 visit, a 2 visit kind of thing?
Typically, it's a couple visits. So we take the history, and there's a very specific, it's like 70 questions in the history. So it's a really thorough history. And then from there, we'll order a bunch of blood work. And then the follow-up visit at that point may indicate that there's further tests that are needed. So if I see signals of toxicity, we may say, look, I advise that you buy this test to look for mercury or this test to look for mold. And those are out-of-pocket expenses often, but really that's critically important for some people. And so that series of evaluation might be 3 visits.
Okay, and is that something that someone can use insurance for? Not the toxicity test, but the actual cognoscopy and the associated test over after it? Could that possibly be covered by insurance?
Most of it is, yes.
Okay.
Even some of the toxin tests are covered by Medicare and TRICARE.
Okay, fantastic. All right, so the next question is what do you think about the effects of fragility, malnutrition, sarcopenia on brain health? Does anyone in primary care screen for these issues as they relate to brain health?
Well, fragility is a big problem, very poor prognostic factor. So that's the difference between chronological age and biological age. So, I mean, I have an 89-year-old guy that I saw, 88. I saw last week. He still plays basketball at the juvenile detention center where he goes down and helps these kids. I mean, the guy's amazing. But I have, 72-year-old patients that are completely frail and bedridden, and they're, so the age difference versus the biological difference. Frailty is something you kind of see. It's the ability to move. There are fancy tests that you can spend money on, looking at telomere lengths and things like that. But as far as primary care, most all primary care clinicians are looking at those factors, and they're using that sort of gestalt understanding of where a patient is as far as their recommendations. So that's the frailty part. What was the rest?
So malnutrition, sarcopenia.
Yeah, malnutrition, sarcopenia are a real problem for a lot of elderly people that maybe have poor appetite. I think COVID exacerbated that. We see a subset of COVID recovered patients that just have poor appetite. And so we want to really focus on dense nutrition and, making sure that they're getting enough calories. Sarcopenia is prevented with exercise, and making sure your calorie intake is important. So we run into this sometime with our intermittent fasting sort of ketogenic diet that we have. There's a distinct subgroup of thin patients that don't do well with that because they don't have the fat to burn. So we definitely use that in those patients. We're using a totally different dietary approach because they won't get into ketosis and they won't do well. And so we definitely want to avoid those things.
Excellent. All right. So we always ask our guests rapid fire questions. So you don't have to take very long to answer these, just a few seconds. And it's more related to the how, right? So you talked about that before. It's not just about knowing what to do, but how to make it happen. So Dawn, you want to kick it off?
I would love to. Okay. So what are your favorite local restaurants and the dishes that you order at those restaurants?
Well, so I don't eat out much. I'll say that. Honestly, I don't eat out that much. I will say I went to it's a very special occasion. We went to Restoration Hardware at the town center, which I think is a steakhouse, but we ordered the mushroom bowl, the broccolini. We had this incredible beet arugula salad. And the guy was like, well, what do you want to eat? And we're like, that's what we want to eat. He was like, no, but like, what's for dinner? We're like, that's for dinner. You can just bring it all. And we had a great dinner there. But it was amazingly tasty, really, really good. And the atmosphere on top of that building is worth checking out. They have this outdoor garden. You can probably sit up there and go have a glass of wine or something if you are so inclined. I recommend that place.
Dawn, I know our next dinner with Dr. Merritt.
Yeah. I know. Yes, I've been there. It is really cool ambiance, but I I didn't really eat anything. I don't think we were just there, I think, to have a glass of wine. So,
Let me ask you
yeah,
this.
we'll definitely have to try all that.
Mhm.
It's good, but Fifth Element, biryani, and also dal, the yellow dal I love there.
Love Indian
Okay.
food. Yeah. All right. So what is your favorite minimally processed packaged food? So if you're in a rush at home and you have something like really quick that you're not actually preparing the entire meal by yourself, what does that look like for you?
Our go-to is usually hummus and maybe pita or, something like that.
Is there a brand that you like?
It's organic. So chickpeas, unfortunately, are loaded with glyphosate. So we try to eat it organic. And I can't remember. I know the picture of it. And I know where it is in the store, but I don't know who makes it.
Okay.
It's in
Okay.
the refrigerator there.
All right.
Okay. I like that. Okay. What is your favorite plant-based money-saving hack? So everybody talks about how expensive it is to eat healthy. What's your best way that you keep costs down?
Well, it's sweet potatoes and beans and rice.
Those are
Okay.
cheap. Those are very
Cheap.
inexpensive and quick. All right.
Yes.
So what is your best plant-based time hack? So how do you save time? It's in the kitchen.
We prep on Sundays and we make big meals and eat leftovers for lunch the next day.
Okay. And what is your best advice for someone who wants to move towards starting to add more plant-based food to their diet? Like, what's the first step?
I get people cookbooks and recipes and I tell them find some things that you like and that are doable and just start using that in your repertoire. So most people they eat the same meals that they're used to preparing. So I just try to get them to swap out some unhealthy meals for some good meals. But it could be like, there's so many different people. Like there's a single guy that doesn't cook, so it's telling them to get Annie's or Plant Pure Nation frozen. If it may be, just take bigger salads and smaller, the junk. It may be like, a lot of people that are busy, it doesn't hurt to fast. You can skip a meal. So when you drive by that fast food place, just think to yourself, that's not food. I'm not eating that. So I like fasting is a good one sometimes.
All right. So please tell us about your current passion project. What do we need to know about what's on deck for you, or what are you involved with?
Well, right now I really am passionate about getting this message out that a lot that can be done for the brain and that people should get checked out rather than hide it. That's number one. And so we are, we're still working out a lot of the logistics of how to organize and make that process both enjoyable or tolerable for patients, as well as having the support programs to make sure people are successful. And we've been working on that for some time, and I think we're getting there. And once we have that down, my job is going to be to take that around the country. So right now I'm working with some really forward-thinking nursing homes or assisted living facilities. And so taking that globally is really my big goal, my big audacious goal.
Great.
Which nursing homes and assisted living facilities are you working with right now?
So we're in Sarasota. Gray Matters has 2 clinics, Jacksonville and Sarasota, and that is Sarabella is the community down there.
Okay.
And they have.
Is that Sarabella in Jacksonville?
No, they're down in Sarasota.
Oh, okay. Gray Matter has a place in Jacksonville. Is that right?
Yep.